Hi, welcome to the Preoperative Bariatric Surgery here at Reston Hospital. What this is going to cover is before surgery, the day of surgery, during your stay, and as you prepare to go home. My name is Roz Barron. I'm the Bariatric Coordinator here at Reston Hospital. I'm one of the nurse leaders, and you can expect a daily visit from either me or one of the other nurse leaders on the floor. My function is to work with the surgeon, the nurse, and of course, you and your family. If you or your family have any concerns or any comments, please feel free to let one of us know while you're here so we can make this a very good stay for you. You are in safe, caring hands. We are accredited by the Bariatric Accreditation of the MBS AQIP. It is the Comprehensive Center designation, and we work together as a team to best support you. So in preparation for your surgery, approximately 3 to 4 weeks, you need to see your doctor, you need to go for any tests, make sure clearances are done, you need to stop smoking, stop alcohol intake. If you're female, you need to use appropriate birth control during this time because you will be probably off your regular. Do schedule a pre-operative interview at least 2 weeks prior to. You can see the number on the screen, and typically you press 1 and that will guide you through very quickly. During the pre-operative appointment, they will go over your medical and surgical history. Please have a current list of medications, including any over-the-counter, handy so that you can refer to that. Have also your orders from your surgeon, list of doctors, contact numbers, and pharmacy information because this too will be asked. You'll be told at that time if you need any other tests and how to prepare for the surgery. So the day of surgery, what you'll want to do is bring a few things in, like your ID insurance card, any adaptive equipment such as eyeglasses or hearing aids. If you like, you can certainly bring your regular toiletries, loose-fitting clothes for after, and a favorite pillow for comfort if you like. Do also bring your current list of medications again. If needed, a CPAP mask. We do use our own machines here, but please know your settings so that we can hook you up to the correct setting. When you come in, you'll need to register first of all. That's on the first floor in 1850 Town Center. We're open from 5:45 onwards. And please do arrive approximately 2 hours prior to your surgery just to make sure that you have time to register, sit down, and then go for your surgery. You will be greeted by a pre-op nurse, by the anesthesiologist and surgeon. An intravenous catheter will be placed and some blood might be drawn. And also the preoperative staff will take you then into the operating room. So after surgery, each surgery takes a little bit different time. Your surgeon will be able to help you with this anywhere between about 1 and 3 hours. And then after that, you'll be taken to the recovery room. Here you'll have close monitoring. One of the things that they will be asking you is about your pain level. So you're going to be seeing a pain scale such as this from 0 to 10, 0 being no pain at all, 10 being the worst possible imaginable. And so they will be constantly asking you what your pain level is. Once when you're cleared from this area, you will be transferred to the 4th floor, which is the surgical unit. You will most likely be groggy and in some pain once when you get up to the 4th floor. You will be greeted by a nurse, by me or another nurse leader, and you will be shown around the room to see how things work. One of the first things that I hear from most of the patients is that they do have some gas pain. One of the easiest way to get rid of the gas pain is by walking. We do have medications that we can give you as well, but we'll be emphasizing the walking component of it. Your pain will be managed, and please do let your nurse know if you do need some more medication. You can use your call bell or phone in order to get a hold of us. Vital signs will be taken once an hour for the first 3 hours, and then after that, approximately every 4 hours. Now, unfortunately, this does mean during the nighttime as well, and I do apologize, but we do need to make sure that your vitals are all good here in the hospital. So your diet, once when you get up to the floor, depending on your surgeon and the surgery that you've had, you may or may not be able to have anything by mouth. You may be able to get some ice chips. You may be able to have a small 1-ounce cup per hour. Now, if you do get a 1-ounce cup, it's not to just drink it all the way back. You will be sipping very, very slowly from this. So it usually takes about 8 times to get through 1-ounce cup. So it's just a little bit of watering your mouth and then just letting it go down. Where some patients do get into a little bit of dilemma is when they have medications by mouth as well. What I would suggest is put the medication right at the back of your throat, tilt your head back and just a incy-wincy little bit of water just to kind of help that go down. That will help to ensure that you don't get overfilled and have the consequences of that. You will be getting a standard liquid tray, and that will be brought up. You're going to have a few different suggestions on there, but once again, only 1 ounce per hour, either 1 ounce of the water, 1 ounce of the broth, or 1 ounce of the diluted apple juice, not one of each, and that's when you first start out. Once again, sip slowly. Make sure that you do consume the right amount and not too much. And we will be measuring your cups. So when you're finished the cup, usually you just turn it upside down and the nurse will be able to count that. You may need to stand up to sip as well. So if you're having burping, hiccuping, any pressure or pain on your new stomach, I would definitely suggest sitting up or standing up, and then gravity will help bring it down as well. Blood work may be done as early as 4:30, and this is so that the surgeons will be able to see the lab work when they come in the morning. So unfortunately that is a little early, but just to give you a heads up that does usually happen. How to recognize a nurse, that they will be in blue and the techs will be in green. Nurses usually give you the medications and check your IV, things like that. The techs can help you with blankets, if you need a walk, if you need your sequential compression devices turned on. Sequential compression devices, or SCDs, go around your legs and they just pump your blood so that you don't get any blood clots or anything like that. Once again, if you have a CPAP machine, please bring it in. We'll hook it up. A mask, we'll hook that mask up to the machine. You'll also be using what's called an incentive spirometer. So that's one of these. This is a breathing machine. You take this and you breathe in like a straw, and then you watch it go up in the middle here and also on the side. You'll be using this 10 times an hour while you're awake, so you don't have to do it during the nighttime, but you'll also be taking this home. What this does is it just helps prevent pneumonia and gets that oxygen into your lungs to help with that. And also, when you're using your incentive spirometer, you can also cough at the end too. Sometimes you have a little bit of phlegm. When you're coughing, I always suggest putting a pillow right on your abdominal area, and then that will help ease any discomfort as well. You will be allowed to shower. However, please be very careful with your IV because I have seen quite a few come out. So depending on where the IV is, what we'll do is we'll put a little plastic bag on it to protect it, but once again, we need to really protect that so that you don't have to get a new one. We do have the SCDs, as I said, to help prevent blood clots. Very important to have that on while you're in bed. So if we forget to hook you up, please just ask us to hook it up. We do have what's called MusiCure music, and this is to help just ease you. It is on channels 81, 82, and 83. And of course, you can choose any other channel, whatever you feel like when you're in the hospital. The nurse and the tech will visit you regularly to make sure all your needs are being met. But once again, we're just a button away if you need us. You can expect to stay in the hospital for a couple of days. Typically, we want you to be drinking about 4 ounces an hour before you go home. This is to make sure that you are getting enough fluids. We don't want you to go home and not have enough. We want you to be hydrated, and if you're not hydrating enough, you may need to come back. So we want to make sure that you're up to about 4 ounces an hour before you leave. Don't rush through this process. We want it to kind of trickle down, make sure you don't have any pain, pressure, hiccuping, burping, anything like that, okay? If you do feel the tightness, pressure, or pain, you do need to stop and then take in less the next time. And once again, standing up or sitting up straight will also help with this. When the medication is given, please only take 1 pill at a time, the maximum 5 minutes in between, to once again make sure that you don't overfill your new stomach. So discharge instructions. So before you go home, I'll be giving you discharge instructions. One of them is to do with incision care. One of the things that I always say is make sure that you don't rub your incision areas, just pat it dry. Make sure you don't take any baths, don't put any lotions on it. Just try to keep that area nice and clean. Activity, you will be increasing your activity a little bit by little bit, increasing your walking, increasing your drinking, doing all of that. And of course, safety is always a huge concern. If you're feeling dizzy at any time, just always make sure you sit down. We don't want you falling. Signs and symptoms that should be reported to the doctor. I'll be going over some of these, such as blood clots, such as a higher temperature. If you're taking Tylenol and it's, you've got a temperature, just give the doctor's office a call. And anything that is uncomfortable, you can always give a call in and we'll be able to help you. Pain management, of course, we always want to make sure that that's managed. When you're going home, you typically just take over-the-counter Tylenol. That's it. It's once again usually the gas pain that is the most concerning while in the hospital. Dietary instructions, you will be slowly increasing your diet over the next weeks, and we don't want you to rush through that process as well. And also when to follow up with your doctor, usually 2 to 3 weeks after you're out of the hospital. We'll want you to phone up and book another appointment. So what we've just done is we've gone over the pre-surgery, what to do before you come in, the day of surgery, kind of giving you an idea of what to expect, and then of course the plan for discharge home. Thank you so much for watching this video. Good luck on your surgery. And at the bottom of this, there's a little area to please put your name, and also if you could put your surgery date, that would help us out. It'll be good to see you. Thanks so much.